Good morning. I am Dr. Amitabh Nandy, tropical and infectious disease specialist. I retired from Calcutta School of Tropical Medicine as head of the department and professor. I worked with Government of India, WHO, and various other organizations as advisor and in other capacity, particularly in academic and research capacities. Today, we are going to discuss about adenovirus and the prevailing situation currently going on, not only in West Bengal, but also in other states of India. The situation has become really alarming, particularly in view of very high mortality rate in children and also in adults. Adenovirus was named as one of the important contributing agent towards the present illnesses, which is currently going as an outbreak in different states. However, based on certain studies by Indian Council of Medical Research, it was observed that around 30 to 33% of all the samples collected, of course, it is a sample survey. It's not all the patients have been screened or all the patients are daily routinely being screened. Out of the sample survey which was done about 1.5 months back, the 30 to 33% of the agents was adenovirus. The rest of the cases were due to, say, rhinoviruses, other related respiratory viruses like influenza A, influenza B, rhinoviruses, metapneumoviruses, and various others. So it will be not fair enough to stamp in the entire outbreak and the entire situation and blame only adenovirus. That is not really helpful for us, and that becomes a bit risky because there are other viruses which are treatable. For example, the swine flu, the H1N1 infection, the influenza A infection. So if we really are getting down with the idea that all such cases are because of the adenovirus, we'll be doing injustice to ourselves. So my discussion, therefore, would be based on, or I am going to discuss in totality, which will include the various aspects of all these respiratory viruses. Now, let us see what is really going on now in our country. For the last, say, for example, around 3.5 months, perhaps, maybe around 3 months, gradually there has been an increasing trend of seasonal flu, or common cold. These are the terms used so far in our community. And these days, what we have observed that many children suffering from the same seasonal flu or the common cold are dying. Now, that was the first signal, first warning sign to explore the possibility of different kinds of viruses. And that brought us to the screening procedure, and that brought out all the results where we observed that around 1/3 of the cases were due to the adenoviruses. Now, so far we knew that other viruses like, say, swine flu, that's a killer disease, no doubt in that. That's a killer disease. If you ignore, if you do not start treatment in time, then it becomes very severe and serious. So that was the scenario, Now, so therefore, to summarize, right now, the entire country is going through a kind of a outbreak, which is clinically of sore throat, fever, sneezing, coughing, conjunctivitis, diarrhea. and finally leading to respiratory distress, difficulties, pneumonia, hospitalization, followed by death. So these are the all sequence of events, what really happens in such cases. And now that was a wonder, so far, in fact, I'm pretty old, I'm 75 years old. So far, we have not seen people dying of adenoviruses. So far, we haven't seen people dying of parainfluenza or rhinoviruses. But now, out of all this symptom complex, what we have observed that people are dying, particularly, especially the children, and that was of great concern. Now, then we try to explore the possibilities of what are the factors why so far in the history we have not seen people dying of adenoviruses in outbreaks, and such a large scale outbreak was also not really reported earlier. But this year in 2023, this is the situation. So that was a great concern for us. And out of these cases, we really believe that some of the cases definitely could have been saved in the initiation if the treatment is initiated early in the right time. Now, the viewers, for the viewers and the listeners, now some of the aspects I'm going to discuss about all these viruses together, but the major thrust would be on adenoviruses. Now, the adenovirus is a kind of a DNA virus, and with all other viruses, all this, as I already told you, that the respiratory group of viruses, including swine flu and influenza A, influenza B, parainfluenza, and blah, blah, blah. All these viruses, they get transmitted through droplet. That means a person who is coughing and sneezing, he delivers through coughing and sneezing huge amount of droplets, and each droplet may have hundreds and thousands of viral particles which get suspended in the air nearby the surrounding the person. And not only that, any person coming to the close range of those droplets get a direct infection through the droplet landing on his nose, eyes, or skin. Apart from this, the another mode of transmission is indirectly through inanimate or objects like, say, for example, mobile phones, say, for example, like the tabletop, like door handles, and in train, metro rail, in buses, all the roads, all the surfaces get contaminated once a person delivers, ejects the droplets. And these droplets, after some distance, it gets settled down and it gradually falls and falls and falls. And if inside a room, it falls everywhere in the room, including the floor, from the floor to the tabletop and all the places. So anyone coming to that room and touching that with his hand, and then his hand gets contaminated. And obviously, once a person's hand gets contaminated with the droplets vis-a-vis the viruses, then there would be every possibility and chances of that person getting the infection, getting the viruses from his own hand, contaminating or touching his own face, nose, and eyes, on blah blah. So this is how the transmission takes place. Now, epidemiologically, for example, what do you mean by epidemiology? Means the current scenario, the how the disease spreads. It spreads from man to man, human to human, as I told you, and particularly in close ranges. And that brings us to the question of familial infection, familial transmission. You might have noticed, perhaps the viewers might have noticed, that a single person suffering from this common cold or seasonal flu brings the infection to at his home, and in the house, other people quite soon they also get the infection, indicating that the person who brought the first infection is the source, and this is the miniature form of the transmission cycle, and in a larger scale, that from the single house it goes to the community, community to places, in cities, in provinces, and in our entire country, in our community. Now, the question is, we have so far seen that these viruses are not a killer disease, not a killer virus, and yet this time we have observed people are dying. Now, what might have been the reasons? Now, that is of great concern. That has to be understood by the viewers also. Now, but before that, we have to know, or people definitely would like to know, how that so far the virus which was non-lethal this year, why it became lethal. Now, what was the reason behind non-lethality of the viruses? Number one is that you might have heard the term of herd immunity, that is presence of the antibody against all these different communicating viruses and the microorganisms which gets communicated, transmitted in the community. In single individual, once he gets the infection, the body starts producing antibodies against that. And likewise, from one individual, as the infection spread to the community and other people, the entire community is now ready to prepare antibodies, and the entire community becomes full of antibody in their blood. And that is known as the herd immunity. So after birth, a child, first when he is exposed to the infection, maybe he would suffer from a more severe disease, but gradually, with years to come, every year getting repeated infection, that acts as a kind of a boostering infection, boostering kind of a vaccination situation. And gradually, the amount of antibodies which is produced in the blood gets accumulated and increased, so that in future he can manage the infection quite efficiently, and the disease doesn't become very serious and doesn't need hospitalization, not the question of death. Now, so the question is, if we are having herd immunity so far, so long, why this year we are observing the people dying in spite of having the antibodies, adequate amount of antibodies within ourselves? That's a great question. There are three possibilities. Number one is that, as I told you, it's not the question of adenovirus only. The issue is, right now in the community, in our country, there are several similar viruses, several respiratory viruses are in circulation. So it's no wonder that one person can get infected with more than one viruses. In addition to adenovirus, maybe he gets influenza virus, influenza A, swine flu, maybe rhinoviruses, maybe metapneumoviruses in addition. So definitely one virus, causing some kind of a pathology, another virus coming in and doing the same bit of things and magnifying the entire clinical situation. So that leads to the patient manifesting in a more severe form. That is one explanation I personally can think of. Now, the other possibility is that the herd immunity, which we have been preserving within ourselves so long, the question is, where has it gone? Is it that the herd immunity is lost, or it is not acting properly, or the entire human body, or our immune system is not really behaving in the right way, proper manner to manage the virus or viruses infection? Maybe that is the reason. And to find out that, to give some idea about that, the situation, the most important aspect, the most important answer or hypothesis which comes to our mind is the post-COVID situation. We know by now that COVID and the post-COVID scenario which have been going on for last couple of years, we are observing that even very simple infections are getting complicated in those people who had COVID or who had COVID vaccination. Now, these two issues, these two things, one is COVID and the other one is COVID mass vaccination, that perhaps has played some role. It's purely hypothetical that has to be proved finally, that might have played some role in modifying the way our immune system behaves against the viral or any infective agent's challenge whenever it occurs. Now, the question is, so if that is the case, now where from we got such possibilities? Now, during the last couple of years, what we are observing, say, for example, a simple dengue infection is getting more complicated. People are getting down with multiple repeated infections, repeated microbial infections. For example, a single person suffering from chickenpox, within a couple of weeks, he's down with chikungunya. Another 2 weeks later, he's down with dengue. Another couple of weeks later, he's down with urinary tract infection, and so on and so forth. So all these observations has brought us to definitely think and suspect because that was not the only difference between the two era, say before 2020 and after 2020. We can clearly differentiate, demarcate these two time periods, and one that is the most important issue what we are observing. So keeping in mind, therefore, now why I have been telling you all these juggleries, all these scientific issues, which has not yet been proved finally, confirmedly, but we can hypothesize. Now, the only reason is that, keeping in mind that most of us, including the children, got infected with COVID viruses either clinically or subclinically. Particularly the children. We know that children didn't manifest the COVID infection during the COVID period, and that was simply because of certain physiological aspect of our body, that the virus didn't do that kind of a harm to the children in contrast to the adult population. So that was one of the other reason, perhaps this thing, and that another thing is maybe the production of antibodies, which leads to the herd immunity, the continuation and maintenance of the level of the antibodies in post-COVID situation has gone perhaps in a little bit erratic way. And the qualitative and quantitative aspect of the antibody and its protective nature against several microorganisms is no longer perhaps there. So with the background, or with this background, let me come to now to the points of, say, what are the symptoms, so why we are concerned about this. Now, not only adenoviruses, but also all other viruses, as I told you, all other respiratory viruses which are currently in circulation in our community, they manifest with, initially, as I told you, the virus is a respiratory virus. We get the infection initially through our nose, through our mouth, through our eyes. And that is the point where the virus first lands up. That means in the backside of our throat, inside the nose, in the eyes. So all these mucosal infection leads to the local multiplication of the bacteria in these localities, in the part inside the face, inside the mouth. Now, from there, the virus gradually multiplies, destroys the local cells one after other, because they need for their multiplication, they need the help of our own cells. So one cell which is full of viruses, it ruptures, leading to release of millions and billions of viruses which infect the other nearby cells. And that leads to the symptom, that the feeling of sore throat and cough, sneezing, a runny nose, sometimes lacrimation, that means watery eye, redness in the eye, pain, severe throat pain, all these local symptoms appear. And then the virus travels down to the respiratory tract, to the lungs. When the patient develops pneumonia, he develops respiratory difficulty, and then there would be a need for hospitalization. Besides this, particularly in adenoviruses, there are 4 or 5 types of symptom complexes or manifestation. For example, one is the respiratory type, as I told you now. The other one is the conjunctivitis. There is redness of the eye, there is lacrimation, and this third one is the diarrhea, watery stool, diarrhea, pain abdomen, vomiting, all these things comes. The fourth category would be, in addition to all these things, one may have a burning micturition. That means urinary tract infection like symptoms. Sometimes the liver gets infected, he feels very pain in the abdomen. So all these are the manifestations of all these diseases. Once a person suffers from these, then the virus gets internally and he starts fever. So it's not that the person who gets the infection will be having fever from the day zero, but usually what we are observing is the fever comes 2-3 days later. Initially, it starts with cough and sneezing and throat pain, all these things. Now, usually, by and large, the entire clinical manifestation gets down, and the person becomes absolutely okay and cured within 5 to 7 days. But unfortunately, in persons who are immunologically compromised, particularly, say for example, in the children age group and the older age group, and persons who are under immunosuppressive therapies, and besides this, there is a large chunk of people who are known as the post-COVID persons or long COVID persons, and more or less almost many of the vaccinated individuals, or in the reverse way, we can put it like this, that whoever is developing complication with all these viruses, he is definitely giving a history of either taking COVID vaccination or suffering from COVID in the past. So with all these symptoms, usually it doesn't need any kind of a hospitalization. But one thing is definite, that you people, once a person starts with any one of these symptoms, you must seek a medical advice. Medical consultation is one of the very important step which you people should take, should not hesitate to go to the hospital or any clinic. I would request you people not to undertake certain activities like going to a medical shop, asking for certain antibiotics like azithromycin, like doxycycline, like blah, 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 many other antibiotics. Now, this not only is useless in these cases, as we have discussed during the COVID period, that azithromycin and any other antibiotics, they don't have any role in case of viral diseases, including COVID. So here also, all these antibiotics, none of these antibiotics has got any role to play in the process of cure. It is a disease which is self-limiting. It cures itself spontaneously because of the development of immune response, very strong immune response, which kills the viruses. But as I told you, another deviation this year, that in contrast to all earlier years, this year we are observing that the duration of illness, instead of 5 to 7 days duration by and large, is getting extended for 2 weeks, 4 weeks, 3 weeks, something like that, and that is perhaps because of the low immunity or altered immune systems activities, maybe because of the COVID and post-COVID vaccination. Now the question is, what else you have to do? How to know that what kind of viruses you are suffering from? Now, there are, in contrast to whatever we have seen during COVID period, that every individual would be diagnosed on the basis of the RT-PCR as having suffering from COVID virus. But that facility is not existent in these kind of viral diseases, for example, adenovirus and all related viruses. But we do have very definite and very a good diagnostic tool for swine flu individually, and collectively, of course, collectively, we do have similar all these viral infections, which is known as biofire test, which is being carried out similarly, the sample being collected similarly as we have done during the COVID period. But that is highly expensive. It ranges around, say, 16 to 20,000 rupees per test. And it's not only expensive, but also it's not available everywhere in our country. Every district or every rural area, urban area, they are available in larger cities, in specialized hospitals, specialized institutions. So the diagnosis is mainly based on the symptom complex. So symptomatically, I summarize, the adeno and other related viral infection manifest in the upper respiratory tract illnesses. The diagnosis is mostly symptomatic on the basis of the clinical features. If something goes wrong, the disease gets complicated, the duration gets prolonged, then one may seek the help of that specialized molecular diagnostic tool, although they are expensive for the correct diagnosis. Because out of all these viruses, I told you earlier perhaps that it is the swine flu and influenza A group of viruses which has got a definite and very good antiviral drug, and which can take care of the disease very good. And the early we initiate the treatment, better is the result in case of swine flu. So for that reason, if in some cases, if the person is getting respiratory problem, difficulty of breathing, this thing, you must seek help of all these diagnostic tools. If it is positive for swine flu, don't hesitate to you can ask your physician to help you in prescribing this specific drug. Now, what you are going to do? We know that there is not a very large scale, very cheap diagnostic tools are available. We do not have any drugs at our disposal to take care of adeno and other related viruses, excepting swine flu. So what to do? And already we are in a kind of outbreak throughout our country, in different cities, different provinces. Now, what to do? We have certain definite, we have social responsibilities. We have a role to play in public health system. And that is twofold. Number one is you should prevent yourself from getting infected. By that, you prevent your family from getting infection. And out of that, if at all you get by chance the infection, you always must try not to transfer the virus from yourself to any other person, including your family members and the community. In that direction, what are you going to do? As I told you, it's a droplet infection. So use of mask, especially the N95 mask, would be very useful tool, particularly when you go outside, go to the office, go to a crowded place. You must always wear a N95 mask. Don't hesitate to use a mask even in your office, in your other places of work. Number two is, as I told you, the other mode of transmission is through your own contaminated hands. So hand washing is the another most important preventive practice, which you should bring it back from that COVID situation. You must recollect perhaps how we have been using the hand washing during the COVID time. So hand washing, at least with a good soap, and it's not necessary to have warm water, any simple water with soap with a good leather, at least for 20 to 25 seconds minimum. Good hand washing would prevent the transfer of virus from the inanimate objects to yourself and to others. So this is how you can prevent the infection within yourself and from you to the others. Now, lastly, one thing I must tell you, that there is a good vaccine available for swine flu, that is H1N1 infection. And always I consider it's my privilege that I got this opportunity to bring before you a kind of a message that all people, considering the viral infection, the increasing rate of the viral infections in our community, particularly the lethal H1N1 or swine flu infection, you must have the swine flu vaccine one shot every year. Unlike the pneumonia vaccine, which is taken one shot every 5 years, or other vaccines, so like for measles, like tetanus and other vaccinations, these virus vaccines, these swine flu vaccine, you have to take one shot every year. So with all these, I believe that I have been able to give you some idea about the prevailing current diseases and the outbreaks and your roles and responsibility. I have also tried to explain things so that you can understand, that you are already immunologically, rather we all are immunologically compromised by the influence of COVID virus and the vaccine. So this is ultimately, we are going to find it out for finally what is really true or not. But we at least hypothetically, or based on our day-to-day clinical observations and epidemiological observations, this much I can tell you, that the period, the era before 2020 and the time or the period beyond 2020, there is a huge difference in terms of people's, by large, so far as a community level, their response to different infective agents. And there has been a large amount of changes, vast changes, which we have been observing, the way human beings are behaving in managing different infective agents. So be careful not only for yourself, to you remain safe, and try to not to not to spread the virus or any other infective agent from yourself to the other. And at the same time, you must protect yourself from the surrounding infective atmosphere and the polluted atmosphere in terms of the virological, viral and the bacteriologically polluted environment nowadays, what you are going on through. So I believe that this is going to give you some benefit. With all these, thank you very much for patient hearing and observing this video. Thank you very much.